Hello, it's Dr. Erica. Thank you for joining me. Thank you. Please like, share, subscribe. Also, leave comments about any topic messages that you would like to hear. This is Dr. Erica, pharmacist for close to 10 years now. I'm the owner and operator of Millennium Pharmacy. Website is themillenniumpharmacy.com. Please check out some of the products that I offer, as well as medical devices that are available for you. And let me know what you think in the comment section. This particular video is going to talk about how to report adverse events that you expect or that you have actually experienced at home with prescription medications. Now, these are medications that you actually get from the pharmacist on the pharmacist's approval. So you want to make sure if you're experiencing any type of side effects, any abnormalities, you report these events just for post-marketing, for safety, reporting, and so forth. Not to be downgrading or adversely affecting a company's reputation, but just to get this information to those who are regulatory and can help with the help with marketing information and help with health care for the community. So again, that information will be utilized to help with bettering the outcomes for other people and for post-marketing research and things like that that will help bring better outcomes for other individuals as well. So again, the FDA does have a phone number. They do have a website as well where you are able to log in and report any type of adverse events with any type of prescription medication that you actually get from the pharmacy after they review it and dispense it to you. You get home, you may feel sick, or you may develop some sort of anaphylactic reaction or a rash, or you may experience some sort of dizziness or headache that's not typical or unusual to you. Then let FDA know. A lot of people don't know about this resource, but I'm going to let that be disclosed in this particular video. Please keep it confidential for yourself and like and share as well with others that can benefit. And it's only for the good of the community, not to, again, degrade any company or anything or bring someone down, but it helps to make sure that other people who may be experiencing the same thing can know about that particular side effect or that particular event that you experience. I think it's anonymous. You don't have to report your name. Just give out the statement of how you felt, what you experienced, how long it lasts, the event lasts, and what triggered it. What do you think was the problem? So the FDA does allow that information to be reported, and a lot of healthcare providers do know about this website and phone number. I listed it in the description for this particular video, so do take advantage of it when needed. Now, there's also some information I wanted to give about IUD, or intrauterine device. I've done a video on that as well. I left that video link in the description box as well for you, and you can review that information. And then there's also another website online that talks about how it works, so forth. I put that in there as well. Now, the brand name is called Paragard, and it's a copper intrauterine device, and it's been on the market for a few decades now, and it's the only FDA approved IUD or intrauterine device on the market thus far. No other brand has been on the market since Paragard has been approved. And there are some side effects, of course, and then it also will last up to 10 years once implanted, if I'm not mistaken. So do check out that website, Paragard.com, and learn more about it for yourself if that's something that you're interested in. As far as not oral contraceptives, it's an implant, so you don't have to take it by mouth. And also, the doctor has to do the insertion in the doctor's office, so it's a one-time insertion, and then you utilize it for a few years, and then you get another implantation after that if that's your choice. Some of the side effects is going to be a long period, or longevity of bleeding, heavy bleeding, and then there could be some spotting in between. Also, those are some of the main side effects if you have cancer or you've had a pelvic inflammation, things like that. Do refrain from using this particular implantation for contraceptive. Uh, so I would suggest maybe something else instead. So do understand that those are some of the precautions before using this particular device, and they want to make sure that patients understand that they should avoid this particular item if they're pregnant. Again, of course, you want to avoid that if you're pregnant, if you have some sort of cancer, breast cancer or uterine cancer, if you have pelvic inflammation, things like that, you want to avoid the IUD form of contraceptives. Also, the implantation, again, it occurs in the doctor's office. There might be a large fee for that, so it might not be economical for a lot of people, but again, it does have a 99% effective rate. And I would recommend it for someone who definitely knows that they're not going to conceive, or definitely know that them and their partner do not want to conceive for a long period of time. Then yes, this could be an option. And it works as a copper device. The device actually works by inhibiting the male's actual contribution to conception. So it doesn't affect the women's hormonal level. It doesn't affect the women's um, cycle as far as hormone changes throughout the month. What it's going to affect is the male's aspect of, or the male's contribution to the conception. And then also, there might be some sort of immune response, changes in the female's immune response to implantation. So that may be something to think about before choosing this particular option. Always think about any prescription medication, especially something that is going to be implanted for years and years, to consider. So I would definitely check into that with your doctor's office and find out if that's best for you. So again, I do have some other videos about this. Do check it out, and please like, share, and subscribe. I'm Dr. Erica. Take care. Bye bye.